Lindsay, I'm glad you asked because I think a lot of people are confused about what IBH really is. I guess the simplest answer would be that it is a coordinated system of medical and behavioral health services treating the whole person. And what we mean by behavioral health is mental health and substance abuse treatment and any kind of treatment that is helpful to managing physical health. So everything from depression and anxiety and trauma, substance abuse, to helping somebody manage their diabetes. So in the integrated setting, which in our program, the integrated settings are in primary care, which is either a larger medical clinic that sees the general public, or pediatric or adolescent specific clinics. So the social worker coordinates assessment, treatment, and follow-up services. One way to think about it that I like to tell the students is that it's really like adding the neck to the body of medical care and the head of traditional mental health services. In integrated behavioral health, the social worker is always going to function as part of a team, a multidisciplinary team. And that, depending upon the setting, the members of the team may vary, but the primary care provider or any other medical providers for a particular patient would be team members. The role of the social worker is, it can depend again upon the setting. Sometimes it's more about coordinating care and providing case management. Actually, in almost all of the settings that our students are placed in, there's a lot of therapy services that are provided. And so let me talk a little bit about what that looks like. One thing that is somewhat unique about the integrated setting is that the providers are able to do what's called a warm handoff. And what that means is that if a patient is there for an appointment with their physician and they're experiencing some kind of distress or they have some kind of psychosocial need that isn't being addressed, the physician can ask the social worker to step in, make the introduction, kind of talk a little bit about what they think the issue is, and then the social worker can, right there in the exam room, can conduct an assessment and provide either a brief intervention or a case management referral. In some cases where the person's highly distressed, it might be crisis management if the person's suicidal, for example. So all of those would be considered warm handoffs. The other side of that is that occasionally there's a warm handoff in the other direction. If the patient is in the clinic for therapy services and to see the social worker, and they have some kind of physical distress that needs immediate attention. So it's kind of nice that it works both ways. I mentioned that in the settings here in Kentucky where our students are, psychotherapy is one of the services that social workers provide in the primary care clinics. Most of the IBH social workers have a caseload that they maintain, and that can range from individual therapy to couples or even family therapy. Certainly when children are involved, the parents are also involved in the treatment process. So our students have had excellent opportunities to learn psychotherapy skills. And I would say the last area of a social worker's role is education and training. The social worker in integrated behavioral health settings tends to be the behavioral specialist. And so I know in several settings where the social worker actually provides education and training to the physicians and the larger staff about behavioral health. So it's a pretty wide-ranging role, but because it's behavioral health, it also takes into account substance abuse and, as I said before, those other issues that are maybe more related to medical conditions. Great question, Lindsay. IBH is definitely part of healthcare reform, and regardless of where the money for healthcare reform goes under the current administration, the path is already pretty clear that the integrated approach has many benefits and that the medical and insurance industries are behind it. So I would say the key issues that are most important in terms of the role of IBH in healthcare reform is that it's a patient-centered approach, and that has many dimensions, but it's very important, and it's like a cornerstone of integrated behavioral health. And that the coordination of treatment is very beneficial on different levels. It improves treatment outcomes for individual patients. It reduces overall healthcare costs, especially for decreasing the disparities among high-risk groups, and reducing healthcare system costs for systems and communities. I'd say another area that's very important is that it increases outreach to underserved populations, because people come through the door because they have, a sore foot or a bad cold or whatever, and you find out that they're struggling with substance use problems or depression or unresolved trauma, and these issues can be identified and treated right there in the primary care setting. Another example of outreach to underserved populations is, for example, in the Family and Community Medicine Clinic, they have some smaller clinics, and one of them is the Transform Clinic, which is that serves LGBTQ patients, and so there are those kind of specialties that sometimes reside right in the clinic. And so say somebody comes in to see their physician and they've got flu symptoms, but they also disclose in the course of the appointment that they're struggling with gender identity issues. Well, that physician can make a referral to the Transform Clinic, which resides right here within the clinic, but in doing so, the PCP is likely to inform the social worker, if maybe at the same time or first, to talk to this person, and then when the person does follow up on that referral with the Transform Clinic, there would be a social worker available there. So that's a really nice example of how the coordination can play out, and how the social worker would meet with that person right at the warm handoff, and maybe the same social worker would be the one to follow up in the Transform Clinic. So there's some very nice elements of coordination that aren't really possible in other models of healthcare. We have many of the practicum placements are in Lexington, but not all of them. We do have people who are interested in practicing in rural Kentucky And so we have White House clinics, have 3 different locations in Eastern Kentucky, and we've got some other options too for rural placements. This year we have 3 students in Eastern Kentucky. And in terms of the other clinics that are closer to Lexington, we have very large clinics like Family and Community Medicine, Health First, and then there are smaller clinics like the practice that one of our students is in. It's a pediatric practice that's where it's a smaller size in terms of the number of medical providers. So it has a very different feel than a larger clinic. And we have a mix between pediatric or adolescent clinics and clinics that would see the whole population. I mean, Family and Community Medicine is an example of one that would see, the entire population. Lindsay, there are no additional credits. So that's not an issue at all. There are 2 electives that are specific to IBH, and there are additional trainings that are provided. Each semester, students participate in 2 what's called Go Deeps, which are, go deep into a particular subject.
Okay.
So one of them, for example, that I do is on brief interventions in primary care. We've also had one on suicidality, on bullying. So those are our trainings that are provided free and just enhance people's clinical skill set.